What if I told you that the perfect blood pressure your doctor is aiming for could actually be putting your life at risk? For decades, we've all been taught the same rule. 120/80 is ideal. Lower is better, safer, healthier. But after the age of 75, that belief can quietly become dangerous. Let me ask you something. What if the number you've been working so hard to achieve, the one your doctor congratulated you for, is actually increasing your risk of falling, hospitalization, and even death? Because that's exactly what a major study published in JAMA Internal Medicine found. Researchers followed more than 15,000 adults over the age of 75 for 5 years. These were not perfect textbook patients. These were real people with diabetes, with previous strokes, with heart conditions, just like many of you watching right now. And the results were deeply unsettling. Older adults with so-called perfect blood pressure below 120 had a significantly higher risk of serious falls. Not minor stumbles, but falls that required hospitalization. Even more concerning, they also had a higher overall mortality rate compared to those whose blood pressure stayed between 130 and 140. Read that again. The group with the best numbers had worse outcomes. Now, I want to be very clear. This is not about ignoring your health. This is about understanding that after 75, your body plays by a completely different set of rules. I'm speaking to you not just as someone who has read the research, but as someone who has seen this pattern unfold again and again in real life. I've seen the 7, 8-year-old patient whose medications were increased to chase a perfect number, only to come back months later after a fall in the middle of the night. I've seen patients told they were doing great on paper, while struggling with dizziness every time they stood up. And here's the uncomfortable truth. No one is explaining this to you clearly in the exam room. So, in this video, I'm going to walk you through what most people, and even many clinicians, are still missing. I'll show you the blood pressure range that is actually associated with longer survival after 75. I'll explain the biological changes happening inside your body that make lower pressure risky. And most importantly, I'll teach you a simple 3-minute test you can do at home tonight that could help you detect a hidden danger before it leads to a life-changing fall. If you find this kind of honest, evidence-based information helpful, consider subscribing and supporting the channel. It helps this message reach the people who truly need to hear it. Because when it comes to your health after 75, what you don't know can hurt you. Okay, let's get into it. Here's the trap that almost no one sees coming. For years, you've been told the same thing. Lower blood pressure is better. Lower means safer. Lower means you're doing everything right. So what happens? You go to your doctor. Your reading is a little high, maybe 145/85. A medication is prescribed. Then another. Months pass. The number drops. Now it's 125, then 120, maybe even lower. And everyone is pleased. Your doctor looks at the screen and nods. You're told, "This is excellent. Keep doing what you're doing." On paper, everything looks perfect. But here's what nobody is asking. What happens when you leave the clinic? Because the real danger doesn't show up when you're sitting calmly in a chair with your arms supported. It shows up later. It shows up at 2:00 inches the morning, when you wake up and need to use the bathroom. You swing your legs off the bed. You stand up. And in that moment, everything changes. Your blood pressure, which looked perfect while sitting, suddenly drops. The brain doesn't get enough blood. The room starts to spin. You reach for the wall, but your hand doesn't quite find it. And in a split second, you're no longer dealing with a number on a screen. You're dealing with a fall, a fractured hip, an emergency admission, weeks of rehabilitation. And for many people over 75, that one fall becomes the moment everything changes. Mobility declines. Independence slips away. Life never quite returns to what it was before. Now here's the part that changes everything. The real problem is not the number you see while sitting. It's what happens when you stand up. Most people think blood pressure is a fixed number. But it's not. It's dynamic. It shifts second by second depending on your position, your hydration, your medications, and your body's ability to adapt. And after the age of 75, that ability changes dramatically. Let me explain what's actually happening inside your body. Because once you understand this, the entire picture becomes clear. The first change is something called arterial stiffness. When you were younger, your blood vessels were flexible. They expanded as blood was pumped through them, then gently pushed that blood forward, maintaining smooth and steady flow. But over time, those vessels lose their elasticity. Think of it like an old garden hose left out in the sun for years. It becomes dry, rigid, cracked. It no longer bends or cushions pressure the way it used to. Your arteries behave in a very similar way. So now, when your heart pumps blood, those stiff vessels can't absorb the force. They can't help maintain flow as effectively, which means your body actually needs a higher baseline pressure just to push blood all the way up to your brain, especially when you're standing and working against gravity. Lowering that pressure too much doesn't protect you anymore. It starves your brain. The second change involves something most people have never heard of: your baroreceptors. These are tiny pressure sensors located in your blood vessels. Their job is to constantly monitor your blood pressure and react instantly when it changes. In a younger person, this system is incredibly fast. You stand up, and within milliseconds, your body responds. Your heart rate increases slightly, your vessels tighten, blood pressure stabilizes. You don't even notice it. But after 75, these sensors become slower, less responsive. So when you stand up, there's a delay. Your blood pressure drops, but your body doesn't correct it quickly enough. And if your resting pressure is already being pushed low by medication, that drop becomes much more severe. This is what we call orthostatic hypotension, and it is one of the most under-recognized causes of dizziness and falls in older adults. Now, there's a third factor that makes this even more dangerous. Your body no longer processes medications the same way it used to. Your liver and kidneys, which are responsible for breaking down and clearing drugs, become less efficient with age. So the same dose that worked perfectly at 50 can linger longer in your system at 75. It builds up. It acts more strongly than intended. And it continues lowering your blood pressure, even when your body doesn't need it lowered. That means your reading at the clinic might look stable. But inside your body, the effect of that medication is still unfolding, still pushing your pressure down, sometimes too far. And when you combine all three of these changes, stiff arteries, slower reflexes, and stronger medication effects, you create the perfect conditions for a dangerous drop in blood pressure the moment you stand. This is why the perfect number can become a perfect storm. Now let's talk about the data, because this is where the story becomes impossible to ignore. Remember that large study we mentioned earlier, published in JAMA Internal Medicine? Over 15,000 adults, above the age of 75, were followed for 5 years. Not ideal patients, not carefully selected cases. Real people, with real conditions, living real lives. And the researchers did something very simple. They grouped these individuals based on their systolic blood pressure, that top number you see on your reading. Below 120, 120 to 130, 130 to 140, 140 to 150, and above 150. Now, most people would expect the lowest group to do the best. But that's not what happened. In fact, the group with blood pressure below 120 had the worst outcomes in several critical areas. They experienced significantly more serious falls, the kind that lead to hospitalization. They had higher rates of acute kidney injury. And most importantly, their overall risk of death was higher. Let that sink in. The perfect number was associated with more harm. Now compare that to the group whose blood pressure stayed between 130 and 140. This group had the lowest mortality. Not the lowest. Not the most aggressively treated. But the most stable, the most balanced. And what about those above 150? Yes, their risk of stroke and cardiovascular events did increase. That part hasn't changed. So now we're left with a truth that challenges everything most people have been told. Blood pressure that is too high is dangerous. But blood pressure that is too low, especially after 75, can be just as dangerous. This is the uncomfortable middle ground that rarely gets discussed, because it doesn't fit into a simple message. It requires nuance. It requires thinking beyond a single number. And most importantly, it requires understanding how your body responds in real life, not just in a seated measurement. Now here's the part that puts that knowledge into your hands. Because there is a simple way to detect this hidden risk yourself. A test that takes less than 3 minutes. No hospital, no specialist, no complicated equipment. And yet, it can reveal something that routine checkups often miss. It's called the orthostatic blood pressure test. And it measures something far more important than a single reading. It measures how your body responds to change. Here's how you do it. Tonight, before you go to bed, lie down flat on your bed or a couch. Stay there for 5 full minutes. Let your body completely relax. Then, while still lying down, take your blood pressure. Write that number down. Now, stand up. Immediately. No waiting. No delay. And take a second reading as soon as you are upright. Write that down as well. Now compare the two. If your systolic pressure, the top number, drops by 20 points or more, or if your diastolic pressure, the bottom number, drops by 10 points or more. That is a red flag. That means your body is struggling to maintain stable blood flow when you stand. And that puts you at risk. Let me give you a real example. Lying down, your reading is 125/78. Looks perfect. Nothing alarming. But the moment you stand, it drops to 98/64. That's a 2.7-point drop in systolic pressure. That is not just a number. That is your brain receiving less blood than it needs every single time you're on your feet. And here's the problem. Most doctors don't routinely check for this. They measure your blood pressure while you're sitting. They see a good number, and they move on. But they're not seeing what happens when you stand, when you walk, when you live your daily life. And that's where the real risk is hiding. So this simple test does something powerful. It reveals the difference between looking healthy on paper and actually being safe in your body. And for many people over 75, that difference can mean everything. Now let's make this practical. Because once you understand the risk, the next question becomes very simple. What should your blood pressure actually be? Not the textbook number, not the one-size-fits-all target, but the number that is right for your body at your age. Here's what current evidence suggests. If you are between 65 and 74, and generally in good health, a systolic blood pressure between 130 and 140 is typically the safest range. It offers protection against heart disease and stroke without pushing your pressure so low that it compromises blood flow. But once you move into the 75 to 84 range, something important shifts. Your optimal range moves slightly higher, around 135 to 145. Not lower, higher. Because at this stage, your body needs that additional pressure to maintain circulation, especially to the brain when you're upright. And if you are over 85, or if you are physically frail, dealing with balance issues, weakness, or multiple medical conditions, then a systolic pressure between 140 and 150 may actually be the safest and most appropriate target. At this stage of life, preventing falls, preserving independence, and maintaining quality of life often matters more than aggressively lowering a number. Now let's talk about the bottom number, your diastolic pressure. This is just as important and often overlooked. In older adults, your diastolic pressure should not fall below 65. Because during that phase, when your heart relaxes, that's when your heart muscle itself receives blood. If that number drops too low, you are actually reducing blood flow to your own heart. The ideal range is typically between 70 and 85. So if your readings are consistently below that, even if your top number looks perfect, it's something that needs attention. Now, Let me show you why none of this can be reduced to a single universal target. Imagine two patients. Both are 81 years old. Both walk into a clinic with the exact same reading, 158/88. On paper, they look identical, but in reality, they couldn't be more different. The first patient has mild heart failure, early kidney disease, and struggles with joint pain that affects balance. The second patient is active, independent, plays golf twice a week, and has no major underlying conditions. Same age, same number. Completely different situation. For the first patient, aggressively lowering blood pressure with multiple medications could be dangerous. It increases the risk of dizziness, falls, and further kidney stress. The smarter approach might be a conservative target, around 140 to 145, with minimal medication and careful monitoring. For the second patient, there may be more flexibility. Lifestyle changes alone could bring that number down into a safe range without medication at all. This is the key message. You are not a number, and your treatment should never be based on a number alone. It should be based on you, your body, your symptoms, your risks, and your daily reality. Now, let's bring this into something you can actually do starting today. First, if you are over 70, and especially if you are taking blood pressure medication, start measuring your blood pressure at home. Not once, not occasionally. Twice a day, morning and evening, for the next 2 weeks. Write every reading down, because one clinic measurement tells you almost nothing, but a consistent log reveals the truth. Second, perform the orthostatic test we discussed. Lie down, measure. Stand up, measure again. If you see a significant drop, don't ignore it. That is critical information. Third, pay attention to your body. Do you feel lightheaded when you stand? Do you notice moments where your vision dims? Do you feel unsteady, fatigued, or mentally foggy for no clear reason? These are not just normal signs of aging. They can be signals that your blood pressure is running too low for your needs. And finally, have a different kind of conversation with your doctor. Don't just ask, "Is my blood pressure okay?" Ask this instead: what blood pressure range is appropriate for me, given my age, my health, and my daily life? Bring your log. Bring your test results. Show up informed. Because the goal is not to chase a perfect number. The goal is to stay safe, stable, and independent for as long as possible. So let's bring all of this together. For years, you've been told that lower blood pressure is always better. That 120/80 is the gold standard, the number to chase, the number to trust. But now you've seen the reality. After the age of 75, that rule no longer holds. In fact, pushing your blood pressure too low can quietly increase your risk of dizziness, dangerous falls, kidney problems, and even death. This is not about ignoring your health. It's about understanding that your body has changed. And the strategy that protected you at 50 may harm you at 80. Here's the truth most people are never told clearly. After 75, the goal is not just to live longer. It's to stay on your feet, to stay independent, to protect your ability to move, think, and live your daily life without fear. Because one fall, one moment of instability, can change everything. That is why this matters so much. And that is why I want you to take one simple action tonight. Do the test. Lie down. Measure your blood pressure. Stand up. Measure it again. It takes less than 3 minutes. But it could reveal a hidden risk that no routine appointment has ever shown you. Don't wait until something happens. Check now, while you still have the chance to prevent it. And if this video made you think differently about your health, I want to hear from you. How old are you? Write your age in the comments below. Because the truth is, your age changes everything when it comes to blood pressure. Also, share this video with someone you care about, a parent, a partner, a friend over 70. Someone who might be chasing the wrong number without even realizing it. And if you haven't already, consider subscribing. Every week, I break down complex medical truths into simple, practical steps you can actually use in your daily life. Because you deserve more than quick appointments and generic advice. You deserve to understand what's happening inside your own body. And always remember this: prevention is consistently easier than treatment. I'll see you in the next one.